All right, hello everybody. Let's see, it is 5 o'clock Eastern time, 4 o'clock Central time. So let's go ahead and get started. Let me set up my screen here. All right, can everyone hear me okay? Great, great. Awesome. Well, first off, just wanted to say welcome and happy Saturday to everybody. Thank you so much for joining us for the next edition of this VPSA Chat. So this topic today, we are so excited to have this incredible panel joining us to be answering your questions, the ones that you have submitted already. This topic is something that students have been requesting for quite some time, and I have to be honest that I was struggling quite a bit to figure out how to go about this, struggling how to put this together, what was allowed, what wasn't allowed. So again, we're glad that we have this going on today. So just wanted to thank our panelists, our speakers for taking the time to join us. A lot of this, there's work that goes behind the scene. There's work that just kind of going, the mental, the emotional preparation it takes to kind of speak and to be on a panel. It does take a lot out of some people. I honestly have to admit that I am very exhausted after these calls, but just very happy to see all of you. And a few housekeeping items before we really get into the conversation for today. The first is, if you haven't already done so, I think everyone's already muted themselves, but just so that audio is clear or as clear as possible throughout the call. This is also being recorded, so it will be added to our YouTube page and posted on our Facebook page. If for any reason we need to take it down, we will go ahead and do that. If you need the content or the questions and such, or the contact information, please always feel free to reach out. And then I also wanted to mention that today's topic is going to be centered around things about the medical field and people's experiences working in the medical field. And there's going to be lots that we're going to cover. We're going to do our best to answer all the questions that were submitted. But we may not get through all of them, and I hope that's okay. But also to mention that there are going to be certain things that our speakers, they're going to do their best to give you as much as possible, but there's going to be certain things that they can't get into, specifics that they won't be able to really talk about. So I hope that we can all respect that boundary. So if you ask a question and we veer to a point where the speaker can't speak on it, again, I hope that we can respect that. Cool? All right, so let's go ahead and get started with some introductions here. Dr. Kelly, could you go ahead and kick us off?
Hi, everybody. First of all, thank you, Bang, for doing this. I think this is a really important thing to kind of at least get a conversation going with the different members of the organization. My name is Dr. Catherine Garrett Kelly. I'm a life member of the Eta Delta chapter at Howard University for Tau Beta Sigma. I was the national president for Tau Beta Sigma from 2015 to 2017, and I'm an honorary member of KKPsi. My first honorary came from the Southeast District, so if anybody's from the Southeast District, yay. I am a double graduate of Howard University. I went there for undergrad, and then medical school I graduated in 2007. I currently own my own medical practice, so Kelly Collaborative Medicine here in Silver Spring, Maryland, where I do primary care. I also am fortunate to work with the homeless population here in the county and doing primary care for them, as well as I'm a nocturnist as needed in the hospital. So I'm actually on backup call every other Friday during the pandemic. If they have a surge, they'll call us in as backup. So I would say some funny, interesting or inspiring facts about me. I actually became a parent at 15, so I was a teen mom, and I speak Russian. So I took Russian as my language in college because I did 4 years of Spanish in high school and wanted to do something different. And I actually wanted to go to Russia and get my MD, PhD in medical anthropology, focusing on Russian health studies. Didn't happen, but I enjoy the path I'm on now.
Awesome. Thank you so much, Dr. Kelly. Very cool. We'll have to do another session with just, I guess, hearing you speak Russian. No, she said no. All right, very cool. All right, let's go ahead and for our next speaker, would you mind giving us an introduction as well?
Hello, guys. My name is Ryback. I am a alumnus of the Delta Sigma chapter of the UT Arlington KKPsi. I'm currently a second-year pharmacy student at the Ben and Matey Fish College of Pharmacy at UT Tyler. Right now, I am currently serving a 70-hour rotation with CVS in the Dallas-Fort Worth area. And I've been a pharmacy technician for 2 years, the longest stint of which I had with Kroger Pharmacy in Euless, Texas. And I am very excited to be part of this panel to give some insight to what pharmacists, pharmacy technicians have to role and play in this pandemic. I guess the fun, inspiring fact about me is that um, I am Filipino and I did immigrate here in 2004 along with my family, and I became a naturalized citizen around 2011. Um, that being said, I'm a clarinetist. I still keep up with playing the clarinet as much as possible. But I mean, hey, pharmacy school's tough. There's not a lot of time between all the pharmacology tests that you got to take and still try to play your etudes. So if you are considering doing anything in the medical field, but also going into medicine, you can and should do it.
Awesome, awesome. Thank you so much. Appreciate it. All right, our next speaker, would you mind giving us an introduction as well?
Yes, absolutely. So, hi everyone. My name is Emily. I am an alumnus of the Lambda Tau chapter of KKPsi at Central Michigan University. I actually graduated with my bachelor's from CMU in 2018, and I've been in a little bit of a gap year type thing. So I'm finishing that up. I work as a medical scribe actually for 4 different outpatient specialties, multiple physicians. And this August, I'm actually headed all the way back to Central Michigan to start my first year of medical school. Yeah, so a fun fact about me, I actually have 2, 'cause I think both of these are kind of fun. Number 1, I'm a huge dog lover, and I have almost 200 pins on a Pinterest board dedicated to dogs. I actually added to it today. And I've spent way too much time on TikTok in the past few months, and I know probably 4 dances so far, but I'm working on getting more.
I love it. I love it. So we have Russian, we have clarinet, and we have TikTok dog specialist. I love it. Cool, cool. Okay, I'm thinking of other ideas here as we go forward. So awesome. Thank you so much. And to our last panelist, go ahead and give us an introduction too, please.
So hi, I'm Atia. I am, wow, I can't believe I'm saying this. I'm a alumni member from the Theta Theta chapter from the University of Alabama at Birmingham. I just recently graduated with my bachelor's in public health. I'm currently working as a surgeon's assistant for 3 oral surgeons in the Birmingham area. Besides doing that full time for the past 2 years, I've also been working with the Jefferson County Public Health Department in the epidemiology side, looking at cases of COVID within the Birmingham area. So it's pretty cool. So I get 2 perspectives in this sense. I look at public health and I get the oral health of the, of the pandemic. A fun fact about me, I've spent a lot of time playing Animal Crossing during this couple of months. So if you want to hit me up on Animal Crossing, you can. And I've been trying to, play my flute, but I haven't really done so. So oops. But I'm trying really hard to get back playing my etudes and stuff. But that's all the fun facts about me.
Love it. Hey, I don't think there should be any shame or guilt. A lot of us, as you transition into the real world, music is still a big part of it. It's just maybe doesn't look the same as you were in college. So no shame there. Awesome. Okay. So we're going to start with our first question here, and it's a little bit more open ended question, and we'll get into more specific questions as we go through. And just wanted to set the scene a little bit here. Is we start off all these conversations, all these VPSA chats with bigger questions to kind of reinforce the why, reinforce like the bigger picture stuff, and then we'll get into more specifics. I know some people don't really enjoy that, but I hope that since this call is for a wide range of people, again, this is really just for everyone to really understand what's going on and to kind of establish themselves in the conversation. So the first question for our panelists, in your opinion, what has been the most difficult thing about this crisis? And we'll start with Atia.
So personally, I think the biggest thing I've had to overcome is the quick turnaround when they released about the precautions with like healthcare facilities. So within 48 hours, I've been told I have to wear 2 types of protection, as in like surgical gowns. I gotta wear 2 of those, and I gotta wear an N95 mask. On top of that, safety goggles, and on top of that, a face shield. It's been really hard, because breathing in those masks, it's hard. And another thing is just like, trying to calm patients down as they're coming in to get, with their wisdom teeth taken out, or like their single tooth extractions and stuff. They're freaking out about, oh, I might be, in like they're scared about, getting in touch with COVID. And so it was hard to overcome the steps of, hey, you have to get all this protective gear on as well as try to calm down the patient as you do so. So I think the biggest obstacle I've had to overcome is the adaptation from like 48 hours from like not using any PPE to using PPE personally.
Awesome. Thank you so much for that. Emily, what about yourself?
So, besides wearing a mask for 12 hours a day, that's probably the worst part, honestly. For me, as a really big planner and someone who always likes to be looking ahead and know what's going on, the hardest part has been the uncertainty, especially in the beginning when this happened, since we didn't really know a lot about the virus itself and kind of how it behaves. And it's kind of hard to fight against something that you don't really understand. Just the uncertainty has been really bad, especially working in the healthcare field. You have this uncertainty of, have I been exposed? Am I exposing my family? Is this a symptom? Is that a symptom? What's going on? And also, I know for a lot of people, the uncertainty about whether school is going to start back up in the fall, or is this event going to get canceled? What's going on? Yeah, for me, I think the hardest part has been the uncertainty about all of it.
Great. Thank you. Ryback, what about yourself?
To piggyback what Emily had said, it's the uncertainty for me as well. I am the president of my pharmacy class, the class of 2023, and one of the things that I've had to personally deal with is just the changing nature of things whenever we got back from our spring break and found ourselves basically stuck at home because of the new lockdown procedures that have been in place. I have had to coordinate with several of my professors to um, either move exams or get additional material to help us study for exams that we now have to take in advance or take in top of another exam. Um, Finals week was definitely kind of um, a little bit hectic because we were still trying to cover material. I believe it was even like, I think 2 days even before we were supposed to, go into the weekend. But I mean, I'm really proud of my class. I'm really proud of everyone in my pharmacy school because we've all gotten through it and we've all moved forward. Now, heading into my rotations, I can also echo what T had also mentioned with the PPE. Every time that I head out to a rotation site, fully decked out, gloves, um, mask. Unfortunately, we don't have N95 in my CVS rotation, but we make do with the mask that they still do give us. Lots of hand sanitizer, and then just trying to keep everything as normal as possible for everyone because one thing that you have to do during this kind of situation is to remain calm because people are now looking to us as their leaders basically because everyone in healthcare is now in the spotlight, and so we have to keep calm. We have to make sure we're sharing the right information, the correct information at the right time in order to make sure that we're really helping our patients to um, stay safe and to get better if they are getting sick with COVID.
Thank you for that. Dr. Kelly, would you mind wrapping up this question with your perspective? What's been the most challenging thing?
Well, so for me personally, the two most challenging things I think is my desire to want to jump into the middle of this as a doctor. Like, I feel like the reason that I became a doctor is for these kind of things. This is what I'm trained to do. I'm an internal medicine physician, so I was trained on hospital medicine, and that's balanced out with my like fear of spreading it to my family. So I know for a fact if I go and work in the hospital, I can't go home. And that's because I don't want my kids to get sick or my husband who has asthma to get sick. So that's been a big fear, as well as like not having enough PPE in the office to open up the office and make sure that my staff is safe. I think the other side is that telemedicine, although I've been doing telemedicine for about 2 years, doing telemedicine full time, all day, every day is very draining. Like you sit in front of a computer screen all day. I've only been doing it for 7 weeks, but that's definitely a challenge. I would say for my patients, I feel like the biggest difficulty for them through this crisis is that fear of the unknown and that anxiety that any of the symptoms they're having in combination with other things is a life-threatening situation. Because I think some of the fears that they only hearing about the deaths, they're only hearing about this many people dying from these kind of things. But I do think it's made them more conscious about their own health.
Yeah. Thank you for that. Yeah, thank you to all of our panelists for sharing that. And obviously there can be some overlap in this, and I hope that as I was kind of watching around to see people and the people were nodding and such, and I think we can all agree that there are certain things that are hard with this and difficult, and I think the unknown is what I keep hearing has been really difficult, and just the fact that there are people out there, frontline workers, medical professionals who are just really out there making a change, doing what they can to help. And for me, like, it's a really good perspective because I'm sitting here complaining about things I have to do. I'm not at the forefront of the danger, so it really gives a lot of us good perspective. So thank you for sharing that. The next question, again, this is for all of our panelists. So there's how do I say this nicely? There's this belief that we're in America, we're invincible. So like we're bored with COVID. So like, we're just going to go back to normal life. And there's also this mentality in certain areas. So it's like, science is like fake news, right? So with all that being said, from your experience and being directly involved in all of this, what is the best way, what is your suggestion for brothers and sisters to help people who, maybe other brothers, other sisters, bandmates who have families or their lives are being affected by the virus, or maybe their own family members who are affected by the virus? What suggestions do you have? And we'll start with right back here.
So the biggest advice that I can offer is, again, remaining calm, taking everything into consideration, because like what you said, there is a lot of people talking right now. There are a lot of voices clamoring for attention. Some of them are sincere. Some of them are not sincere. They just want to step into the spotlight right now for clout. And obviously, those voices are very detrimental because while everybody else is trying to help people, some people are just trying to get rich or get their name out there just for fame and fortune. The way that I have personally reached out to fellow brothers and sisters that have been affected by the virus is if they make it apparent to me that they've been affected, to treat them with respect, to give them time to um, let them grieve, let them speak their worries out. Just because that I know something about the disease and how to possibly treat it or how to possibly stay safe. That doesn't mean that I need to cram it down everyone's throats whenever someone speaks to me about it. Giving them just the time, giving people just the time to express their worries and concerns, and just be a competent listener, an empathetic listener. That's sometimes enough for most people to get by daily and to move on forward.
Great, thank you so much for that. Atia, what are your thoughts on this?
So I've been very fortunate enough to only have a few friends been impacted by COVID-19. But the biggest advice I can give is what Ryback stated earlier is, give them time to process what's happening, to understand what's going on. And then, so, if they do come out and express that they need support, the best thing you can do is have them not really, when you talk to them, not really focus on the topic, and then also tell them it's okay and to look forward rather than dwell backwards, which is so they can it's one thing to have the disease, but it's one thing to live in the mindset that you have the disease forever, which is, it's not the worst case to have it. Some people, people are different. People process the disease, go through the disease differently as others. And for me personally, usually if something bad happened, like anything that sets you backwards, you have to look forward to get you out of where you are right now. So that's the best advice I can give, is to help them, this is not the end of the world. You can always look forward to what's happening now.
Mm-hmm, mm-hmm. All right, thank you so much for that. Dr. Kelly, what are your thoughts on this?
So I think my biggest, as a physician, my recommendation is that every single person should find a primary care physician or somebody they trust medically to help them when they have these questions. If you're having symptoms, if you're having concerns, if you have a primary care doctor that you trust and you trust that they're going to give you the right information, that's the best way to go. If you're dealing with, the different losses, it's very hard because although we're physically distant, we don't want to be emotionally distant. And I think you just sending a message, and I have people that I do this too all the time just to make sure they're alive. Like it's some people that don't have anybody checking on them on a regular basis. So check in on your friends, make sure that they're safe. Even if it's just say, hey, I love you. I just wanted to make sure you was okay. You don't have to ask them any questions. or expect that they're going to be happy-go-lucky or interactive, but just to touch base and keep that emotional connection that we need to at this point.
Awesome. Thank you so much, Dr. Kelly. Emily, what about you? What are your thoughts?
Yeah, my thoughts were pretty similar to what Dr. Kelly had mentioned in the last part of her answer. Just being there for each other is a really big thing. I really dislike that this is called social distancing. It should really be more physical distancing, because socially you can still engage with one another. You can still have these conversations. So my best advice, honestly, is even if you don't know somebody has been impacted by COVID, I mean, all of us have been in some way, but just reach out. And if you live close by, if you're going to the store anyways, ask them if they need anything, or ask if, do you want to have like a video call tonight? I really like House Party because you can play games. So it's like a virtual game night kind of thing.
Yeah.
So just make sure that you're checking in on each other. And even if you don't know exactly what's going on with them, just, treat them as though they're going through something. Just be like, hey, I miss you. I hope everything's going okay. When this is over, I can't wait to see you. Just, yeah.
Great. Thank you so much. Thank you to all for all those responses. So my question, the next questions are questions that have been submitted by people who have registered for the event. So as we go through these questions for all listening, we're probably gonna have one or two panelists speak on it, and then we're just going to go through the questions as they've been submitted. But as you come up with more questions, I know there's already been one that's been sent to me. If you figure out more questions or other things you want to ask, please feel free to type in the chat box. Our speakers will do the best they can to speak on things, but there's certain things that they can't speak on. So we'll just kind of roll with that. So the first question here that we're going to do one or two panels for, there were remarks about or suggestions about reaching out to people and checking up on people. Have you seen any effective ways to reach out to brothers and sisters during this time to check up on people? What are your suggestions? What are your thoughts on ways that students can be checking up on people?
I think we kind of answered this in the last question to a certain extent, but I think you got to kind of feel people out, because sometimes Zoom calls they do Zoom all day for classwork and that kind of thing. So that may not be the best route for them to have an interaction. I'm old, so one of the things that I like to do is actually write. And I would say, if you are in a position and you feel comfortable in that, to write to somebody. I also make little things. So maybe sometimes I'll send somebody something I made for them. And of course, now there's always an abundance of caution with that kind of thing. But sometimes just writing to someone and using paper, for me as an old person, is a good way to reach out to people. And I've had people write me notes. They write thank you notes. They'll write, different things like that. So I think that's for all us people that are over 40, I tell y'all I'm 26, but 26 plus 15 years experience. Write a letter, or just pick up the phone. Sometimes having an actual phone conversation, we're not used to doing that anymore. That gives a real personal touch, because a lot of the text messages and emails sometimes can be a little impersonal.
Yeah, and if you don't mind, thank you so much for that. If you don't mind me kind of adding into that, I definitely do agree. I think that I myself, I love Zoom, I love meetings and such, but since this has happened, I have just Zoom fatigue. And not that I don't want to see people, it's just there's just something different about the way this connection is. And I've definitely been Zoomed out. And I will say over the past couple of weeks, I've had more and more calls with people that have lasted, about an hour or over an hour. It's been really, really refreshing. So thank you for sharing that. I think that's really insightful. Does anyone else want to share any other thoughts, any ideas that you've had on this that you've seen successful or that you've tried for connecting?
Yeah, so I'm really thankful for my chapter in, getting alumni involved in all there is to do. They've invited me several times to their meetings, to their brotherhood events, to come by. If you guys haven't seen me already on either the meme page or meeting grounds, I often do a lot of Jackbox nights to just get people to come around and have fun and have a good time to get the weekend started, right, or to end off a weekend. And the thing I found out that actually helped me, especially when we were still in online school, was to fire up a Zoom call and then just let my friends know, hey, I've got a Zoom call. I'm just going to be doing homework in the background, but if you can just log on with me so that I know that someone's there to keep me accountable and, say hi every once in a while, that really helped me through, especially the days where I felt like doing nothing because it's so weird to be stuck at home, but then also still expected to do everything else that you would normally do as a pharmacy student.
Great, thank you so much for that. So the next question here, I think we've really, we've talked about it, right? Like, what does reaching out look like? I guess I want to reframe this question a little bit here is when it comes to, I don't know if anyone else can attest to this or not, but as I'm looking through assessing this past few weeks, there are there are highs and there are more lows than I would like to admit. And there's certain times where when it really comes to not even the disease itself, but it's just like any of my other health concerns, I don't know like what to prioritize, what to think about. Like everything gets jumbled. My health, the way I'm eating, my sleeping schedule, everything is just sort of just kind of jumbled up. And I really don't know, like, again, how to like really prioritize myself now that I'm just stuck in one spot all day long. Can anyone speak to, just any advice or suggestions on how students can start to reframe themselves to start to take care of themselves and maybe teach that to others as well?
So what really helped me during my time in quarantine is to, establish like a routine. So you wake up every day at a certain time, and then the night before you would plan on what you plan on doing. Like, oh, I'm going to spend a couple hours on my homework. I might take an hour to go, walk my dog, and then maybe spend an hour on Zoom with my friends, and then, cook myself a healthy dinner. It's just, if you set yourself a routine, you won't feel like you're stuck, and you're actually feel accomplished when you accomplish your task. So that's what helped me got through with it. I mean, of course, before when quarantine first started, I slept all day because, college students and we love sleeping. But it got me feeling pretty down, and I've read the internet posts and my doctors have recommended, start a routine, wake up early in the morning, not like 1 o'clock in the afternoon, but like around 8 o'clock, 9 o'clock, and establish your routine, do daily exercises, just like accomplish small things. So at the end of the day, you feel like I've done something today rather than just sit around in bed all day. So that's what I recommend.
Okay, thank you so much for that. Any other thoughts on this? It's okay. So we'll go on to the next question here. So let's see. The next question here is, with everything that has taken place and all the changes that people have endured, it's clear that we're all leaving this experience with some scars, some more than others. What suggestions do you have for helping some of those, helping heal other scars? Like if you have brothers who are coming in, sisters, family members who are leaving scarred from this, how can you help heal them?
I'm speaking from my own perspective, I guess, as a physician, but I really think how you heal these scars is by making sure that your focus is on your physical and mental health. Eating better. I mean, we kind of being forced to do a lot of things that we've been yelling at each other to do for a long time. So eating better, not eating as much fast food. People are stuck in the house, so they're like, oh my God, I want to go exercise. You only really appreciate it when you can't do it anymore. So and I think we're gonna have to really put a lot more energy into mental health. We know that that's been lacking for years. We talk about this every time there's any type of dramatic experiences, including school shootings and all of those things. And how do we get better mental health into the younger population specifically, because you guys are going to have to live with the ramifications of this crisis for a lot longer than some of the older people. The economy and the world under you is going to change a lot more over time, and there's going to be a lot more consequences than we're going to ever see. The older population, those people that are in their 70s and stuff like that aren't going to feel that as much. They already on Social Security. They're not going to have to deal with it the way that you all are going to have to. So having somebody to talk to long term, creating those safe spaces now that you can have long term is going to be helpful. And taking this as a renewal, that you kind of get to leave a lot of the negativity, a lot of the things that you didn't do right in the past, because we're gonna have to all start over. If that means that you find a passion in doing something that you really love, and this has brought that out, encouraging that among people and using that to heal yourself, to be specifically involved in something that makes you happy.
Thank you so much for that. Any other thoughts on this?
Yeah, so with the mental health thing, one thing that I do want to say is that, everyone handles these things differently. So if you see one of your friends and they seem to be handling it a little bit better than you are, it doesn't mean you're wrong. It doesn't mean they're wrong. Something you can start doing now and definitely when this is over is, give yourself grace and allow yourself to feel what you're feeling and understand that it's normal. And especially when this is over and you can start seeing your doctors again and start having, in-person visits, talk to a doctor if you feel like you need to talk to someone, go to therapy, and especially when we can see our friends again, try seeing them and try having those face-to-face conversations again. Because mentally, this is really draining on a lot of people. And when this is over and you're able to kind of start going back to our new normal, basically, try to get back into that routine of being with friends, talking to your doctor, therapy if you need it.
Mm-hmm.
Yeah, take care of yourself mentally for sure.
Thank you. Thank you. So just got a question here, and I think it's appropriate to add it into this part before the next one. So the question is, with even before this pandemic, healthcare, finding the right physician, insurance was all really hard to navigate, and it was really overwhelming. So now we're in this crisis, and it seems even more difficult to figure out what to do. What are some resources that you guys could share, or that people could look into to kind of help navigate when it comes to their insurance, finding the right physician, or just getting healthcare?
I'll jump in and try to answer this as best I can. It unfortunately, insurance is rather complicated. And because part of it is going to depend on where you get your insurance from. So if you get your insurance through your employer, you have to choose one of the options that they give you.
Mm-hmm.
I'll speak to my husband. I don't have insurance through my company. I have insurance through my husband, and we have Blue Cross Blue Shield, but we have a very, very specific plan. So we had to go through and look and see who was in our network. So that's important. If you have insurance, the person needs to be in your network,
Mm-hmm.
and then they have to be accepting new patients. And you also have to find somebody that you'd like to have a relationship with. So I would say read their reviews. ZocDoc is a wonderful tool. We use that in my office. People leave reviews. You can make appointments on there. There's a lot of resources that go through there, and a lot of times it'll tell you which insurance that you have that they accept.
Mm-hmm.
None of you should necessarily be on Medicare unless you're disabled. So Medicare is specifically for those who are disabled, who are over 65.
Mm-hmm.
Most doctors do take that, but the way, you still have to go through the same process, because some doctors don't take any insurance. They're a concierge, or they're a point of service person who just pay for what they do for you, and then you get reimbursed through your insurance.
Mm-hmm.
If you can't afford insurance, that's kind of where the exchanges come from, healthcare.gov. And if you can't afford insurance because you don't make enough money, that's where Medicaid comes in. So Medicaid is state-based and need-based. So you have to apply through your state for Medicaid. Part of the problem is that when all of this stuff kind of happened with the ACA about 10 years ago, a lot of states did not expand Medicaid. I'm very fortunate that Maryland is a state that expanded Medicaid. So that opened up the opportunity for a lot more people to get insurance. So, I would say if you already have insurance, call your insurance companies or go to the website. That's the best place to start first. The websites can give you a list of any providers that are in network for you. Most of the time, if you're looking for a primary care doctor, so primary care doctor is going to be somebody who is going to kind of be the gatekeeper for your care. They're going to be the person that you go to first line when you need something for your physicals, for medication refills, and also to have guidance on who to see next. Most primary care doctors are either internal medicine or family medicine doctors, or they're also nurse practitioners that, and it depends on the state, because here it's a certain amount of supervision that goes with that, but most of those are the people who are primary care physicians. And then they would determine whether you need to see a specialist, or if you need to see a cardiologist or pulmonologist, and that's usually based on your medical problems. The only other thing, and it's specifically for women, is a gynecologist that would help you in some other female things, but most primary care physicians also help with those needs. So start with your website for your insurance. And if you don't have insurance, then try healthcare.gov, because they can also answer questions for you.
Awesome. Thank you so much for that. Is there anything people wanted to add?
I'll add to that just a little bit. Sorry, right back. I'll be really quick. if you're unsure of like what doctors that you can trust, you can look to your friends and family that live around the area. I know I have a bunch of my friends that I definitely would trust and be asked like, hey, if I don't have a primary health care, who should I see? Or I would recommend check out with your mom. Your mom probably knows everything. My dad knows everything. So I would check with the people that you trust to see the physicians that they trust, because if they trust them and you trust your friends, and you can bridge the gap there. And that's what I personally recommend if you don't know where to start.
Okay, thank you for that.
So one of the biggest disconnects that I often see whenever people start talking about insurance is the fact that you might have one insurance company providing it, but there are different aspects of that insurance plan, that insurance coverage that correlate to specific types of care. So in my case, pharmacy insurance is different from what Dr. Kelly's office might see in medical insurance. Sometimes they're paired together on the information. So when you access information about your medical insurance, your prescription insurance is right there with it. So will all your other insurance information be there. Other insurance companies, they don't make it easy. And so the only insurance you often see is the medical insurance, and you are often left to find out what's my prescription insurance, what's my vision, what's my dental. So when you guys are looking at what kind of plan you guys are wanting to get, or if you are currently covered right now, take the time to really look into the fine print. What's covered, what's not. If you are on chronic medications, like for example, inhalers, or medications that you now have to constantly take, maybe for depression, look into your pharmacy plan coverage. What do they cover? What do they not cover? Have there been any changes to like your copays recently? Take really good care of your insurance, and just to make sure that you know what's going on, so that way, whenever you go for a doctor's visit, whenever you go to the pharmacy, whenever you go to a dental visit, you're not suddenly surprised that there's now a $7,000 charge that you have to cover.
Yeah, thank you all for that. I definitely I learned some things, because I will admit myself, there's sometimes where I look at these things like, well, I guess we're not doing anything today. We'll save this for tomorrow. So thank you for sharing that. Again, to our attendees, if you have other questions, if you want more specifics on, please go ahead and type it into the chat. This next question here, do you have any recommendations for how brothers and sisters can start to plan for the fall semester, especially with all the uncertainty? What are certain things that that students are learning, or the things that we're learning right now during this pandemic, that students can take into their chapter operations, or just for their fall semester if they do or don't have a semester in person? What are some of your suggestions to help students plan for safety, for wellness, for health when it comes to their chapter members? We'll ponder that one. So, and I guess I'll kind of, oh, go ahead.
Can any of us answer? It doesn't matter who answers?
No, go ahead.
Okay. I work as the sponsor for, not the sponsor, sorry, the alumni liaison for Ada Delta at Howard, and this is going to be a challenge, because marching band is not something that you can do virtually per se. And how do you figure out what that service is going to be? And I think a lot of what we may have to do is be really creative. This is going to be a time when each and every one of you can come up with some really innovative ideas on how we approach the different parts of our service. And especially for Kappa Kappa Psi, musicality and musicianship is a big part of that. So I think you really may have to focus on the musicianship part, and how do you get people practice, and how do you have some accountability for them when it comes to that. That may be an area to focus on, because you can do that virtually. And I think, just being open to being flexible in how we approach those different things, and how we make music together but apart. I mean, that's going to be really challenging coming into the fall. So just keeping a positive attitude and some flexibility is going to be important.
Mm-hmm. Thank you for that. Any other thoughts on this, and how chapters can sort of start to plan for something with the unknowns?
I think just talking with your band directors, the chapter sponsor, any other faculty at the School of Music, start talking to them now instead of waiting until August. And one, you can see if there's anything they could use help with when it comes to prepping for the fall. There might be some projects within the, School of Music that you could actually help with. And I would also suggest, if you have other music fraternities at your school, whether you're KKPsi and you also have Tau Beta Sigma, or you have any of the other fraternities that are around, like Phi Mu Alpha or Sigma Alpha Iota, try talking to them too and see if there's anything that they're kind of interested in doing and that they could use help with, or if there's anything you can collaborate together on. Just definitely start communicating now. So you can get the ball rolling, and if there is anything, then you can have ample time to plan for it and get it going for the fall.
Thank you for that. And we had a joint council meeting last night with the national councils, and something that some of the band directors are starting to, or the athletic band directors are starting to discuss is, let's say they're planning for, yes, we're going to have a fall season. Just planning for it and being prepared. But now people are starting to think about or asking, what can chapters, what can schools, what can band programs do to kind of help set up the band for safety needs, health needs. So I didn't get any specifics last night, but some things I was hearing, they were kind of throwing out ideas of like still kind of trying to maintain some sort of like extra, trying to purchase extra wipes when they can, hand sanitizers when they can, really trying to figure out ways to clean the uniforms more effectively. I don't know if this is true for all band programs, but back at IU, I don't know if we ever really washed the uniforms between performances. It's sort of just like throw them in your trunk, put them back in the band hall, and bring them back out when you need to. So they're trying to think of other ways in which they can help maintain some sort of, because there's a little bit of scrutiny, right? We already know of one band program that has a chapter, KKPsi chapter, that essentially they're getting dissolved because there's no band program, right? They've cut that program for the school, the smaller university. So because of that, a lot of marching bands are now under a lot of scrutiny. They're like, what ways can we cut funding, cut budgets and such? And again, music, these extracurricular activities are being cut. So again, band directors are trying to think of innovative ways in which to have a plan, because some universities are asking for that. Like, if we do have a fall season, what can you do? So I just wanted to add that in as well, as part of like your planning for fall. I heard someone mention, speaking to your band director, speaking to your sponsor, start those conversations now. And pay attention to what you're seeing, ask questions of other programs, so that we can all collaborate on this. Yes, we may serve different programs, different universities, but at the end of the day, like, I think at this point, it's the fight to make sure that marching band, music, athletic bands are still going to be a thing. So again, I think that's something important to think about as well. So Dominic asked, has there been any word on impact of marching bands or any band programs? I've only heard of one so far, and we're hearing a lot more of it being discussed. I hope that we don't have to hear more about this, but at least for the national councils, we're putting into, we're planning out contingency plans for if a chapter does get dissolved because of their band program doesn't exist anymore, what we need to do. So that's something that you may have to think about as well. Sometimes we may think it may not affect our band program because so-and-so, but it might, you never know. And again, that's something that we're all trying to think about what to do. And it's very heartbreaking, but I think that as leaders of our band programs, I think we can help at least start those conversations and help say, like, what can I do? What can we do now that we're at home, now that we have time to kind of think on different things? And I think most students are done with school now. I don't know. But if you are, you may have that extra time to kind of help things out. And this may be a good task, some good projects for your executive councils to really center around. So yeah, I just wanted to add that in as well. Let's see here. Are there any other questions when it comes to health, medical field, any advice that, I guess I shouldn't ask for advice, but any specifics that you wanted to ask about? One question that was submitted earlier, I don't know if we can talk about this. Dr. Kelly, this is for you. Are you able to elaborate about COVID in relation to individuals with health compromised conditions such as diabetes?
And I can, from the standpoint of what's the general recommendation. Mm-hmm. So the general recommendation is that that's considered a comorbid or a complicating factor, just like hypertension, asthma, African American race, unfortunately, and obesity. So we're seeing that there seems to be a correlation that those people tend to get more complications from the virus. And some of it, I specifically will say in the African American community, what the studies are saying is that more of it is from the overall system. So the lack of access, in those communities, there's not as many doctors, there's not as many hospitals. The same thing for rural America, Indian reservations, all of those areas that are considered underserved. It's really an access issue. But, you are at high risk if you have diabetes, high blood pressure, obesity, asthma, or any other respiratory illness, in addition to any autoimmune factors or cancer where you're on treatment. Anything that's going to depress your immune system puts you at higher risk with this. Specifically, it's more of a respiratory illness, and that's why we see a lot more people having, cough, shortness of breath, which is the initial presentations that were so severe, and needing mechanical ventilation or help breathing and things like that. Unfortunately, I just lost my first patient last week, and his symptoms were a rapid decline in respiratory. I would say, well, he had hypoxia, so he wasn't able to oxygenate his blood adequately from the virus, and we see that quite a bit, unfortunately, with patients that have poor outcomes. So I would say definitely talk to your physician if you have any of those, and especially if it's uncontrolled. Uncontrolled diabetes is not it's a risk factor for a lot of other things, not just this. It's a risk factor for heart disease, for neuropathy, for kidney failure, retinopathy, which is an eye issue. So you definitely need to talk to your physician and talk to them about how you control that better and control those other things too. So if you have high blood pressure, you need to be keeping it in a certain space. If you're on immunosuppressants, a lot of the rheumatologists and those people that are giving the injections or the medications are making you get tested before they will give them to make sure you don't have complications. I also will say, like, some of this information and some of the risks are based on very limited information. There hasn't been any extensive, thoroughly vetted, studies like we would do for other things, because things are happening so quickly. We're having to make not rash decisions, but we're having to make decisions very quickly and kind of going off of what we're seeing. But I'm sure in the coming months to a year, there's going to be a retrospective study of everything that's happened and looking at the data. But right now, the data just on deaths and things is telling us that those are risk factors.
Thank you so much. Great. So, well, I'll ask one last question here that was submitted, and then we'll go into our takeaways and our wrap-ups for each speaker. But the last one here is, when it comes to just learning about all of this, there's a lot of information out there, lots of places to listen for different news, different stats and such. In your profession, in your perspective, and all of this, what is the most important thing that we should be paying attention to right now? Any thoughts on that? When it comes to COVID, just kind of keeping safe and such, with all the different news and information out there, what's the most important thing people should be paying attention to right now?
I'm going to say, my thing has always been your personal health and well-being. So what's the best thing for you in terms of what's healthy for you? Mm-hmm. But on the other side of that, also paying attention to somebody else. I think the whole point of this conversation was, how can we reach out to others? How can we make sure that others are okay? So we always talk about your picture has to be full before you can feel others. Mm-hmm. So you have to make sure that you're healthy, that you're safe, that you're in a good mental space first. But then you need to have that time to reach out to others. So if it means, for me, what I'm trying to do, I'm working, my family is working. So I'm trying to be a blessing to somebody else. And if that means that I donate $15 to a charity or $15 specifically to a person that can help them in these times, then I'm trying to do that. And I know everybody's not able to do that. But for you, it could just be a phone call. It could be that you are going and reviewing a medical record for an elderly person, or make sure that their medicines in their boxes or something like that. I mean, there's little things that we can do that are free for other people that can really make a difference right now. Because I think, like we said, that lack of touch, that lack of having some interaction with people is really detrimental to our mental and physical health. So those would be the things that I would say. Making sure your picture is full, and then try to make sure you're pouring some of that out into others.
Thank you. And the person who submitted clarified a little bit more of, because some areas are transitioning back into opening, some states are opening back up. I guess the person is clarifying that on top of that is they're scared to go out, but now it's essentially they kind of have to at this point, but they don't trust that things are going to be healthy, and they're hearing all these different information as well. Is there anything that, I guess they're looking for clarification on like how they should handle this situation, which it's a tough question. Like I myself, I honestly don't know either. I think Maryland is slowly opening up, but the DC's like extended their stay, and then Virginia, who knows what Virginia's doing. So yeah.
In Maryland specifically, for Montgomery County and PG County, they've opted out of getting rid of the stay-at-home order, and most of this is because the contagions or how easily it's spread is based on population density. So if you live in places where there's a lot of people close together, that's going to be a big issue. I think we talk about personal responsibility. If you're going out, you have to wear a mask. You have to wear a facial covering. Crochet masks do not count unless they're covering up a real mask. And I think part of the problem too is how do you access those masks? So part of the problem is like you're expecting people to wear these, but they're not readily available. I've actually seen some in Target and seen some in different places. So I think they're coming back, and we're going to get to a space where they are readily available. So I think if you go out, maintain your distance. And if you're standing in line, make sure you're standing apart from each other. Wear your mask, wash your hands when you get back. If you're in a place where you're going to have to be exposed for an extended period of time, so if you're going to work, then you come home, you change clothes, you wash your hands before you do anything and interact with anybody else at your home. I know for me personally, my office is opening up to inpatient visits starting on Monday, and we're very specific about what that needs to happen. So I would say for example, if you're going to a doctor's office, then make sure you call and find out what their policies are. If their policies are in line with the CDC guidelines, are they cleaning their rooms? And they're not going to be mad that you're asking those questions. These are important questions to know. What are you doing in that space to make sure we're healthy and that, so we're checking temperatures of our patients before they come in, of our staff. We are, everybody has to wear a N95 mask, and we're very lucky. Our county actually gave us some. We had to find some through some other means too, but they actually gave us some, and face shields and gloving up for each person. We don't have gowns. It's not available, and I shouldn't say that. The ones that are available are so expensive that we as a practice cannot afford them. And that's part of the problem too, but just making sure that they're taking every precaution that they can in order to make sure that you're safe when you go out. And ask the questions that you need to ask. Don't be afraid to ask questions, and don't be afraid if somebody is in your personal space, be like, excuse me, I need you to back up a little bit, or if you see somebody, we've seen pictures of people, they pull down their gloves and put the glove in their mouth to play on the phone. People are, and unfortunately we don't always take stuff seriously unless we have firsthand knowledge of having the negative effects of it. But fear can be crippling, and I think that's something that we want to try to balance, is like being able to be interactive and go out and do the things that we need to do, and being cautious on the other side. But I'm optimistic that if I think Governor Hogan has done a good job of talking. Like, those are the people that I would tell you to listen to. I listen to the briefings every day, and they actually send us updates of what exactly we can and cannot do, and those are open to the public, so you can look at the websites and see exactly what for each state, because each state is different. For your state, what are the recommendations, what are the guidelines? Nationally, the guidelines for reopening have not been met by pretty much any of the states that are reopening, which is 14 days of a downward trend. Other than actually New York and New Jersey have seen downward numbers in their COVID cases for the last while. They actually have peaked, and if you look, they're actually coming down and decreasing. Maryland is plateauing. We haven't decreased yet. So, I think you got to look at that information, and the CDC website. I wouldn't, and I'm not saying this to be political, I would not look at the president's briefings. I would not trust them, and you got to take them. I feel like you got to take them as satire, if that makes sense. I'm sorry. I'm not trying to be political, but that's not where you need to get your information from. Do not drink bleach. You won't have an esophagus
Please.
anymore. Do not eat pool cleaner. Do not, feel like you need to go and protest in a crowd with no mask on. Like, just don't do it. It's not smart. But you need to go to the grocery store. You need, and sometimes, Target is open for our pleasure. Like, I think if you go to Target to get groceries, you also can browse a little bit. So sometimes that can make you feel better to be able to look around and buy something that you don't need. So, and I'm always happy to, if anybody has any specific questions for me. Like I said, I can't speak about your personal health care, but I'm happy to try to direct you in the right place. And, you can have my email, you can have my phone number. I'm not, just text me. Don't call me, text me, because that's the best way to get me. And just find that person that you can have that's going to be that person for you.
Thank you so much. Thank you. That was very, very thorough, and I definitely got a lot from that. I don't know if anyone wanted to add anything to that. No, okay. Just wanted to make sure. But the main thing that I really got from that as well, I mean, other than don't drink bleach, that was solid. I mean, so you had said that. I think it was Patrick. He said pick up a blue bottle. I was like, is he drinking bleach? So, but I think for me, what I would like to translate that to as well is as you're looking at this information, maybe it's something that it doesn't have to be a daily thing if it's overwhelming, but maybe, like somebody in your chapter, or maybe your chapters can be that source of information, of kind of like concising, if there is a lot of information out there and like people don't know what to do, maybe your chapter leaders can help kind of bring to light clarity of like what's the information that your state needs to be, in your state, like what your band needs to be paying attention to. Maybe that's a way to provide service as well. So we are gonna wrap up here with this session. Before we do that, I just wanted to take a moment to thank all of our panelists for taking the time to prep for this, taking the time to speak on this. Again, this was something that I found challenging to put together, but I'm sure it's even more challenging to speak on, right? Because these are difficult things to talk about, and especially it's so surreal. It's one of those things that, like Dr. Kelly had mentioned, just had lost her first patient. These are hard things to talk about. So just wanted to thank all of you for your time today, to thank all of our attendees for sticking around and listening. So if you don't mind, if you could all go through very quickly, just like what is your one takeaway? If you wanted to, like one thing, if no one got anything from this, like what's the one thing you want people to take away from this? We'll start with Rack.
So my one takeaway from this is that the healthcare systems have always been kind of in the back because you never really see your doctors, your pharmacists, your nurses until it's time for you to actually go out and get a checkup or when you're actually sick. Now that this is going around, a lot of appreciation has been had now for all of the members of the healthcare team. One thing though that I will say, if you're going to take away, especially from everything that Dr. Kelly said, if you really want to be sincere and really thank all the medical professionals that are working right now, please, again, be very up to date. Try to make sure that you're reading information that's correct, and make sure that, instead of like, seeing all these fads like, oh, go outside at 5 a.m. and start clapping for all the doctors. While you can do that, also make sure that you're also taking care of yourself. You're actually doing everything that you can to, contribute to helping end this pandemic, instead of just doing everything that's, I guess, like a social clout, and trying to profit off of that. So be safe and be well, guys.
Gotcha. Thank you so much for that. Next panelist. I don't know who was ready, but.
I can go. The biggest takeaway you can do from this is take care of yourself before you start taking care of others. When you go outside, wear your mask, wash your hands often. Like what Dr. Kelly expressed, do not drink any bleach. Your health comes first, mentally, physically, and socially. Just take care of yourself during this time. Be cautious of what you do when you go out and all that. So that's the biggest takeaway I can give you. Just take care of yourself before you can take care of others.
Love it. Thank you. Emily, Dr. Kelly.
Yeah, just to echo what everyone said, I mean, you need to take care of yourself, be kind to yourself, give yourself grace to feel what you need to. And don't forget that even though we are social distancing. You don't need to actually socially be distant. Reach out to your friends, reach out to your family, and just make sure that you're continuing to have these connections. Also, make sure you are washing your hands appropriately, 20 seconds, soap, water, wear your mask in public. And if you haven't, take a Clorox wipe or something and wipe down your phone, because you take that everywhere and your phones are Petri dishes. So that too.
But don't eat them, right?
Don't eat them, yes. So mine are some personal pleas. The first one is the more you cry, the less you pee. That's all that happens. So if you need to cry, do it. It's not that big a deal. Cry often. Sometimes I have to in the privacy of my own home. And the second thing is, if you ain't got nothing else to do, pray for me. Like, I got kids at home that are driving me crazy. Like, if y'all ain't heard the stories about Jackson Kelly, I mean, the struggle is real at my house. So pray for me. Ask Jesus to be a fence around these kids, because y'all might see something on the news about me if we can't get them back to doing something. And my poor husband, I feel bad for him. He working from home and he having to deal with these kids, and I get to come to the office every day. I don't know how he does it. So those are my two takeaways from the day.
Awesome. Thank you so much for all of that. And if I could interject mine here, I think the biggest thing that I've noticed just from my conversation with students, that if you have questions, if you're unsure, there's no shame in asking questions. There are so many unknowns right now. There's so many things that, I mean, even we as the adults, we don't know either. But sometimes by students asking and by really pushing on certain things, it puts to the forefront of our minds as a national council, as national leaders, that these are the important things that we should be focusing on. It gives us perspective. So utilize your voice. Like if you're uncertain, again, there's no shame in asking questions. There's no shame in not knowing. And like, just kind of reiterate Dr. Kelly's point, like I genuinely cry at least twice a day. It just kind of happens and I feel so much better. There's no shame in just kind of being able to be honest and open with yourself as well when it comes to your emotions, because we're all going through a lot, and whatever you need to do to get through this, ask questions, connect with each other, cry. So with all that being said, once again, I want just to say thank you to all of our four panelists for taking the time to join us today, and all that you do in your profession, all that you do in your life to help take care of others as well. I will not be up at 5 a.m. clapping for anybody, but I will keep you in my thoughts and such. And I will hashtag stay my ass at home. Looking at one of the social posts I saw earlier. So thank you everyone for showing up. We have another VPSA chat on the 30th. That one will be centered around mental health and wellness. So more details to come on that. I'm just finalizing some people based on their schedule. So more details to come. Be on the lookout for a survey, and thank you all, and be safe.
Ben, can I say one more thing? I just want to tell you thank you. I think this is awesome. And for those of you who don't know, the National Council for both TBS and Kappa Kappa Psi have been very innovative and interactive. And I think if you guys get a chance, really show Bang and the rest of the council some appreciation for that. I'm not saying that they weren't doing this before, but this is a wonderful thing, and I think a wonderful way for reaching out to the students, especially in this time. So I just really want to tell you thank you. I'm so proud of you and proud of the things you're doing, and keep it up.
Thank you so much, Dr. Kelly. All right, thank you everybody. Have a great day. Enjoy the rest of your weekend and stay safe. Don't drink bleach. That's all. Bye.